With the overturn of Roe v. Wade, Alabama moved very quickly to implement a 2019 law enacting some of the strictest abortion laws in the nation. But those restrictions focused on natural pregnancies, leaving some to wonder about IVF treatments. Now, some states make it a crime to destroy an embryo.
And this gives those embryos the same rights as humans outside of the womb. ABC 3340's Ashley Gooden joining us now. And Ashley, how are Alabama laws impacting IVF here?
Well, Brenda and Stephen, CDC data shows 4 million babies are born each year in the U.S. using IVF treatments. It's an important part of family planning. Today, I learned IVF in our state is not being restricted for now.
Comfort of the uncertainty right now in knowing how it is that these laws, not just in the state of Alabama, but in any state, are going to be enacted and what's going to hit certain definitions.
Dr. Beth Malizia is a physician at Alabama fertility specialist. The overturn of Roe v. Wade is uncharted territory for people in her industry. IVF treatment wasn't created until after Roe v. Wade. She says the biggest concern is how the overturn opens the door for other legislation.
We feel very strongly that we want to support women's health care. We want to support a family's right to decide when to build their family and how to build their family, access to medical care in order to help them treat their fertility issues.
As Alabama's abortion law stands, IVF treatments are not impacted because the law relates to pregnancies that are in utero.
In our clinic, it's very clearly defined. Anything that's prior to the time of implantation would be in the laboratory, and for the patient would be in utero once implantation happens. In a naturally conceived pregnancy, it's a little bit harder to define.
Families that choose to dispose of embryos are allowed to do so. Since the overturn, Dr. Malizia has seen an increase in the number of couples discarding embryos instead of keeping them stored in case laws change again. She says while there are many uncertainties and gray areas, IVF patients should still be proactive and ask questions.
I think the women of Alabama need to be alerted to this issue and be aware of what may then become something that does then become an issue that would interfere with their ability to access care that most of us feel is a human right to decide when to grow your family.
Dr. Malizia says while it may seem off topic for a fertility doctor, she also encourages women who are looking for birth control methods to reach out. She says whatever your family plan is, the time to talk about it is now. Brenda?
Ashley Gooden reporting.